California healthcare workers are sounding the alarm. Community clinics are burning through taxpayer dollars on executive salaries and non-essential expenses. And with $2 billion in cuts on the way, the people who are going to pay for it are the families who already have the least to give. Community clinics, which are also known as federally qualified health centers, exist for one reason: to help take care of lower income and underserved communities. They're funded by our tax dollars because the whole point is to improve access to healthcare. Access when you're uninsured, access when you're working two jobs, yet still having trouble making ends meet. And as you would expect, these clinics rely heavily on that public funding to operate. But right now, the entire healthcare system is preparing for significant federal and state funding reductions. In California, that includes a proposal to reduce community clinic funding by about $2 billion over the next 2 years. That's only part one of the problem, though. Part two is that at that same time, financial reports show that some clinic organizations allocate large portions of their budgets to executive salaries and non-essential expenses instead of patient services and frontline healthcare workers. When more clinic funds go towards executive pay, less is available for the services the patients actually depend on. And budget reductions on top of that, it's not hard to see what's coming next. Longer wait times, fewer services, staffing shortages, reduced access to preventative care, and therefore, chronic diseases becoming harder to manage, which is more expensive in the long run for patients, for clinics, for taxpayers, for the entire system. Community clinics serve patients who already struggle to get care, which is why healthcare workers are paying close attention to how that scarce clinic funding is getting used. Like, they know who gets hurt. They know what the consequences are going to be both immediately and later on, and they're sounding the alarm. I partnered with SEIU UHW for this video to help explain how poor internal spending decisions amidst these broader budgetary constraints will affect the stability and the accessibility of care in community clinics.